legislation I talked to at the beginning, the Affordable Care Act, the bill we passed last year. Because part of the budget that passed the House is to repeal that bill. So let me take the two issues together. If we repeal the bill that passed Congress, the health reform bill, and we were to voucher Medicare, what would happen? Well, the Affordable Care Act provided new benefits for our seniors. We're starting to close the donut hole. I don't know whether any of you fall into that coverage gap on prescription drugs or not, but as you know, if you're in Part D, and after you incur a couple $1,000s in prescription drugs, you fall into that coverage gap known as the donut hole. And then you have to pay 100% of the cost of your prescriptions for the next couple $1,000s. Starting in 2010, we start to close that donut hole because of the bill that passed last year. If you fell into that donut hole, and thousands of Marylanders did, you got a $250 check in 2010. In 2011, 50% of your brand name drugs will now be covered if you fall into that coverage gap. And by 2020, the gap will be totally closed, 100%. Well, if the House-passed budget were to become law, that benefit improvement would be lost. We would be back to the full coverage gap under prescription drugs, costing our seniors several $1,000s more in prescription drugs. Secondly, in the Affordable Care Act, we expanded coverage in Medicare to cover an annual wellness exam, an annual physical, basically. It's now covered under Medicare, so that you can take better control of your own health care needs. Thousands of Marylanders are taking advantage of that annual wellness exam. If the House-passed budget were to become law and repeal the Affordable Care Act, that would be lost. That would not be covered under Medicare. Under the Affordable Care Act, we eliminate co-payments and deductibles for preventive care, for your examinations for dealing with diseases before they're known, to try to discover them earlier or to prevent them. That would be lost if the Affordable Care Act were repealed. But I want to get to the most important point of this discussion. As a result of what Congress did in passing health care reform, Medicare solvency, you hear about Medicare, whether we can continue it in the future, Medicare solvency, the health of Medicare, was extended by 12 years. 12 years. So if you repeal the Affordable Care Act, and this is not what your senator's telling you, this is what the bookkeepers are telling you, Medicare will go broke in about 2 to 3 years. We'll go broke. So what we did under President Obama's leadership is extend the health of Medicare and the coverage of Medicare. We also brought down the growth rate of health care costs by over $1.5 trillion over the next 20 years. We brought down the cost of health care. Not the cost of Medicare. We did that also. You don't bring down the cost of health care by bringing down the cost of Medicare. You bring down the cost of Medicare by bringing down the cost of health care. And that's what we did last year. Saving the taxpayers. This is again not what I'm saying. This is what the Congressional Budget Office is saying. Saving the taxpayers over $1.5 trillion over the next 20 years, and extending Medicare by another 12 years, expanding the benefits and coverage of Medicare.